Yeah, so these are exciting times. We have now two therapies, Pretomer and ZS9, that have been shown to be very safe, very effective. They have been treated, used in patients in acute setting. They have been followed up. Patients have been followed in the chronic setting as well. We have data on patients with CKD, with diabetes, and with heart failure. And we have some studies where patients were not on RAS inhibitors. There were some studies where patients were on RAS inhibitors. And in some studies, we have actually initiated RAS therapies or up-titrated RAS therapies. And data, whichever way you look at it, is very favorable in terms of long-term treatment and long-term tolerability of these agents for treatment of hyperkalemia. But I am even more excited because it also opens the door potentially for prevention of hyperkalemia and optimization of therapy for these patients. So really exciting times. So, one big thing is that for patients who currently have hyperkalemia, in which we discontinue the therapy because of the concerns for hyperkalemia, these patients can now, Pretomer is already being approved by the FDA. It's available in the market. ZS9 will be reviewed by the FDA pretty soon. So these therapies are either available or could be available. So for patients currently who are not able to maintain their potassium levels with diet alone, rather than discontinuing their RAS inhibitors, perhaps could be treated with these therapies in the long run. Remember that the current therapeutic options are very good for short term, but not for long term. But we have data with Pretomer all the way up to 52 weeks in terms of safety and tolerability. So the patients can actually, and their providers, physicians, nurses can use these therapies today. Well, concluding thoughts are that, we have been told to be very conservative and be very careful about hyperkalemia because of the risk of arrhythmias. And because of that, we have a very low threshold of discontinuing life-saving therapies for the patients. And I mean, it's very ironic that the patients who need the therapy the most, CKD patients, diabetes, and those with heart failure, are the ones who develop hyperkalemia the most, and they are at the highest risk, and we sort of take away these therapies. So my takeaway message is that we are now entering into a new era where it is not only about acute treatment and then discontinuation of life-saving therapies, but actually moving into a new era where we can chronically treat hyperkalemia and optimize therapy at the same time for our patients.